Hi, everyone. Welcome to our Campfire Chat with Lilly Hennessey. I'm so excited to sit down with you, Lilly, and talk a little bit about a poster that you've been working on. And this has been a big undertaking and project in your life lately, so I can't wait to share it with the Nevis Outreach community. Um, but for those of you who might not know and love you as much as I do, who are you? How are you connected to the Nevis community? And why did you do a poster about CMN?
Yeah, my name's Lily. I think I've worn a lot of different hats in this community, and CMN is a condition that I know pretty well at this point. Right now, I've been helping with the NOR patient registry, working with experts in the CMN field and working on research projects for Nevis Outreach. I've also volunteered with Nevis Outreach for about 5 years now, and I will be on the steering committee for the NOR registry as well. I also have CMN myself, so that's why this condition is so important for me. And I've just been able to meet a lot of patients at the two conferences I've attended. So it made it really meaningful for me to see how impactful this condition is for other people. I basically started this project through my school. I'm in medical school, and I had the opportunity to do a research project to present at a conference at my school. And I wanted to do it on CMN because I'm pretty interested about this disorder, like I mentioned. In case some people aren't aware of recent research developments in CMN, historically, a lot of the research in the US has focused on the for asthma and NCM that can happen in people. More recently, we found that the risk of both of those disorders is a bit lower than it was previously estimated. And so I kind of wanted to take that as an opportunity to look into the other factors that affect people with CMN. Research has shown that these people have, or they report a lower health related quality of life, but they haven't really looked into what's causing that. So I basically wanted to look into that and see why people are having a lower health related quality of life and try to understand that better.
Awesome. Well, I'm really excited to kind of dive into what you have for us here. Are there any disclosures or anything like that that you need to share?
Yes, yeah, thank you for asking that. I think first is, like I said, I'm not a doctor, so if anyone has questions about their own health, please talk to a doctor. I do know this condition pretty well at this point, but I'm not a professional, I'm just a med student. And also, the research specifically focused on large and giant CMN, so most of the conclusions that I talk about are about that condition, and not necessarily like smaller CMN.
Great. Do you want to share your poster with us and we can dive in?
Yeah. So first, the way that I did it was I looked at research published in English from 2000 to May of this year, so like 25 years. And I did something called qualitative methods where I didn't do numbers, I just read it and looked for themes, and tried to understand what the researchers were focused on. I'll share my screen now. So once I read the research, I basically identified 37 different factors that seem to be affecting people's quality of life. And then I put them into 8 different groups based off of trends. Okay, so there are things like physical factors like pruritus, which is itchiness. There's also things like skin fragility that people have reported. People have reported difficulty regulating their body temperature. There's proliferative nodules and sleep disturbance and pain. Then there is associated symptoms, like I mentioned, things like NCM and melanoma. There's also psychosocial factors. People have reported things like emotional distress and bullying and self esteem and behavioral problems and just feeling isolated. There's factors that influence people's families as well. So, like if your child has CMN, parents have reported feeling distress and guilt and isolation. And then people have also reported feeling like they weren't accepted by their family. There's also functional limitations like clothing restraints and restraints on physical activity. People have reported concerns with aesthetics, like having a visible difference things like excess hair on parts of their body and managing scars from surgery. There's also treatment related factors that I identified. Like there's a burden to getting treatment like surgeries. It's very time consuming. So that can mean that people need to miss school or maybe their parents need to take time off of work. Surgeries can also be expensive and there can be complications from surgeries. Then also just from talking to adults, you can see that some people report negative experiences having surgeries, but of course, not everyone says that. Then there's also, I was a little surprised to see research has mentioned a burden of having just a rare disease and having a lack of knowledge due to rare diseases. People feel stressed by not knowing what exactly their risk of cancer is. People feel confused when they don't know what the treatments are. And they can have negative experiences in healthcare when they see doctors that don't fully understand their condition because it's so rare. Like you'll talk to adults and they'll say they went to the dermatologist and the dermatologist didn't even know what condition they had. And that can cause people to avoid healthcare altogether, which can be pretty risky. Then lastly, there's just the burden of chronic disease. Having a skin disease your whole life can be draining for people. Like needing to get skin exams every year can be exhausting, and it can cause people to get kind of tired of going to the doctor and seeing healthcare, especially if you're juggling various specialists to manage this disease. It can become pretty tiring for people. So those are the factors that I identified. And I basically just then took these factors and tried to create a proposed patient journey. Again, this is just my interpretation of the research. People should always consult their dermatologist for official recommendations. But I can just briefly show you my understanding or my recommendations based off of the research that I read. The first is to try to be diagnosed early, oftentimes through seeing a dermatologist soon after birth. And then dermatologists are then able to usually direct you to the right specialists to get the right screening exams. I also recommend connecting with patient advocacy groups like Nevis Outreach to meet other people going through similar experiences. In infancy, people with large and giant CMN often are recommended to get MRI to check for NCM, usually by 6 months, and then see neurology if there's signs of NCM. And then some people like to see surgery to discuss removal. Early childhood, I recommended that people continue seeing their primary care provider to get their well child exams to make sure development is on track, and also considering seeing counseling for any social difficulties. And I recommended meeting someone with CMN if you're able to, because especially when you're younger, I think, Lauren, you've had experience with this. It's really impactful to see someone who actually looks like you. And then in adolescence, similarly, counseling if needed and trying to meet someone with CMN. And then adulthood, one of the main things is transitioning into adult dermatology. A lot of people kind of get lost in that transition from pediatric to adult dermatology because they need to find a new doctor. And so that's a time when a lot of people stop interacting with healthcare to take care of their skin. So that's why that's included in here as well. I can stop sharing my screen now unless you have any questions.
No, I think this is a great start to help us quantify just how wide the net could be as we
Mhm.
encourage people to study CMN. There are lots of things to look into. I always talk as I talk to med students, I always say if you want to come learn about a condition that is rare and where there's still a lot of organic first time research to be done, CMN is really ripe for that. And I'm just really excited to see all the work that you and so many other people, Lilly, are putting into the NOR registry, because having all those data points will really help us take this poster and build out real numbers to say, okay, as we have 1,000 patients in the registry, we know that 20% of them have severe itching, or 40% of them are really concerned about the skin fragility, or maybe that percentage is 90% and we didn't even realize that it was, such a profound issue for our community. So I'm really, really excited about the story that that data is going to tell. And this gives us even some, as you've deep dived on all the literature, thinking about where are the gaps? What are we not even,
Hmm.
are we not studying as much? And I think we all know in the community that psychosocial is so incredibly important, but it is something that even as an organization, we really struggle with. I mean, I know we have our Nevis dad, Sean Reynolds, and Nevis mom, Andrew Bischoff, who are kind of in this community adjacently, but as far as through their children, but as far as having someone that's championing those from like a medical research perspective, we don't really have that. So it's
Hmm.
certainly, but to see all the factors that are impacted by psychosocial, it's really a challenge to me to see how do we move research in that direction as well. So,
Yeah,
um,
yeah, exactly. There's so much we don't know about this disease, but there's so many things that could be impacted by having CMN. So I wanted this poster to kind of just be like putting a toe in the water, just being like, hey, science mentions a lot of these things, and a lot of them could use more data and more research to just learn more about how it's impacting people. And like you said, NOR will be a really great step in that direction.
absolutely. Um, so what do you think as you kind of, you know, see this poster on the wall? What do you want people to take away from it? What's that main impact message?
Yeah, I think it's kind of like I said in the beginning, CMN, of course, like melanoma and NCM are serious and devastating, but CMN is more than that. There's a lot that impacts people's lives, and there's a lot of people with CMN who don't have melanoma and NCM, and that doesn't mean that they're necessarily out of the woods yet. So this poster kind of encourages a holistic view of CMN, and it encourages a multidisciplinary team. So that means just involving psychology and dermatology and your primary care, a lot of different health providers to see a person holistically and seeing all that's impacting their health and not just what's visibly on their skin. Yeah, it's just to try to support all the needs of people, and not just have a really narrow-minded view of somebody and their health. It's to take a step back and see there's a lot that might be impacting someone.
Right. And I think so much of the literature that you were able to review does focus on, to your disclosure's point, on large and giant nevi. And, even as an organization, we've tended to address those concerns and have the most of those people in our community. But I think there's real opportunity for us too, to say, okay, because small and medium nevi affect such a larger amount of people, is there a way for us to do more broad stroke research um, that include people with maybe not large and giant nevi, because there's so little literature out there that even address small and medium nevi at all. So
Yeah. And honestly, that's a big reason why I focused on large and giant CMN in this project. It's just, it's hard to find all the research that talks about small CMN because it's kind of a vague term. You'd have to be looking at all research about all CMN. Plus, like you said, it's pretty limited in some ways. Like if a condition is associated with cancer, people can care a little more. And small CMN generally isn't. The risk for melanoma is about the same as the general population. So it's definitely tricky, and I hope moving forward we can find a way to learn more about all the different sizes of CMN so we can have a better understanding of how certain issues impact certain people more and have more individualized care for everyone.
absolutely. And that is a cause worth championing. Why I sit in this chair every day, and I know what has sent you to medical school, Lily, is providing the best care possible for your future patients, and in the meantime for our population and our community that's associated with Nevis Outreach. And I really appreciate your kind of calling out to how important patient advocacy organizations like this one can be for families. I mean, obviously, I'm probably the most biased person on the universe, but someday I would really love to have a poster, a paper, something that says patients in any condition fare better when they have the support of a patient advocacy organization. And through my work
Yeah.
on the CSD board and others, I've gotten to know hundreds of patient advocacy leaders all around the country. And I really do think that the organizations that we lead do help families and patients lead um, lead well in managing their condition. So I've seen
Hmm.
that with my own eyes, and I'm like, I just want a paper to prove it.
Yeah, yeah, I know. And even at my last conference for Nevis Outreach, I talked to three adults who said it was the most meaningful experience of their life just to see someone who looks like them for the first time. And I don't think that's a statement that people take lightly. Like I think they really truly mean it. And that's just such a meaningful thing
Mhm.
to give someone. So, I mean, you've seen how much I've been involved in Nevis Outreach since I first learned it existed. So I'm really excited to keep getting people involved and meeting people who actually look like them, hopefully at an early age.
Yeah, fantastic. Well, thank you so much for sharing, Lily. Is there any final comments you'd like to make?
I don't think so. If anyone has questions, they can just reach out to me. I'm happy to answer it.
Okay. All right. Great. Thank you so much for joining us tonight. And